most symptoms of depression. Women who exercised when they were in high school and still exercise had the fewest symptoms of all. And this was done in 2006, not too long ago. Again, just examples of what the research is showing with exercise. Let's look at water. Water is something that all of us can afford. It comes from our tap, and for those who don't drink it from the tap, we can buy it. Water is very important for exercise, and I have these two pictures here showing how when we take water internally as well as when we use it externally, it can help us. And many people ask, how much water should we drink? Well, there's hard and fast rules that some people give. I merely tell people, because I heard a doctor who I respect very much, Dr. Agatha Thrash, the founder of Uchee Pines Institute in Seal, Alabama, she says, drink it and make sure your urine stays pale. That's what I tell people, and usually that happens anywhere from 6 to 9 or 10 glasses a day. But as long as your urine is staying pale, you're drinking enough water. I remember I had a 16-year-old who came in to talk with me. She was mildly depressed, and she was having some major headaches, and I said, how much water do you drink? She says, water? I hardly drink water. I said, I want you to start increasing your water. And I was thinking merely of her headaches. Her grandmother came in a few sessions later and said, what are you doing with my granddaughter? I says, we're just talking. At that time, I wasn't into the lifestyle strategies as much. She says, she is doing so much better. And I had to conclude that the dehydration or the lack of water was affecting her brain, and she was feeling depressed. And as a result, after a while, she came in and says, Dr. Parks, I don't need to come in anymore. Now, some of you may say that's too simple. Water can't cure depression. I have no other explanation other than to know, and I've read that mild dehydration or dehydration can also often lead to mild depression. Then we have water being used on the outside. Some of you may have heard the term hydrotherapy. With some of my clients who were bold, I would have them doing hot and cold showers because that increases the serotonin, it increases norepinephrine, it increases various neurotransmitters that's related to depression. And when they were bold enough, would have them alternating hot and cold 3 times, and they told me that it would do wonders for their depression. But many of them didn't like this because it was kind of a, especially the cold part, they didn't like too much. But there are other forms that can help us. In another book that I have, it talks about dipping your arms into a cool sink of water sometimes for fatigue. And there are many ways in which water can be helpful. So water is something that we need to take in because it helps with not only depression, but many other diseases. Sunshine is very good for depression. There's more and more research showing that when you get sunshine, it can help with depression. And interestingly, sunshine helps the body to produce vitamin D when it hits the skin. And there's more and more research showing that vitamin D, low vitamin D, can lead to various mental disorders, including depression. I remember working in a place called Lifestyle Centers of Oklahoma, and there was a gentleman there who was having a real hard time responding to treatment. We found that the vitamin D levels were low. When we increased that, not myself, but the medical doctors increased that, he was like a different person. So vitamin D can do a lot for depression and not having enough. I admonish people, when you go to your doctors, get a vitamin panel to see what your B levels are, your D levels are, and other important vitamins. Sunshine is also good for something known as melatonin. And melatonin helps you sleep at night, and during the day, that same melatonin is turned into serotonin. A lot of these things that the drugs are addressing, we can address naturally. Remember we talked earlier about eating to raise your serotonin levels by raising tryptophan levels? Now if you get enough sunshine, that will also raise your serotonin levels. And sunshine is also important for regulating what's known as our circadian rhythm. Oftentimes, our circadian rhythm is off, and we'll have some problems with that. And I'll talk a little bit more about that in a minute. Another part of dealing with not only depression, but any kind of illness is an old word that we don't use anymore called temperance, which really means self-control. And here's a perfect definition of temperance. True temperance teaches us to dispense entirely with everything hurtful and to use judiciously or wisely that which is healthful. So when we have proper self-control, those things that are good for us, we'll use it wisely. We won't overuse it. Just because soy milk may be good, you don't want to drink 10 glasses of that in a day. You want to use it wisely. And then you want to stay away from those things that are hurtful. So let's look at some of the things that are hurtful for depression. Caffeine and depression. The same wise woman that I've been talking about, inspired writer, she says, the influence of coffee And by the way, her name is Ellen G. White. I should mention that in case you're wondering. Her name is Ellen G. White, an inspired writer. The influence of coffee is in a degree the same as tea. Remember, she wrote this over 100 years ago. Its influence is exciting, meaning it makes you feel high, stimulated, and just in the degree that it elevates above par, it will exhaust and bring prostration below par. Meaning just as much as it lifts you up, it drops you down. And she found this out way before the scientists did. So let's look at caffeine. Caffeine can upset the delicate balance of nerve transmission in the brain. And when that balance is affected, that can lead to depression. One study found in 1996 that women who are heavy coffee drinkers are found to be at increased risk for suicide. So there's something there with coffee. I remember a client that I had who came in who was dealing with depression, and she was drinking gobs and gobs of coffee and Coke. And I said, you know what, we're going to go off of this for a while. She had a hard time because if you heard of people who get off of caffeine, they have rebound headaches and all of that. She had a hard time, but she stuck with it. And next thing I know, her depression had practically gone away. And she stopped coming in. She told me she was feeling much better, and it was merely due to the fact that she was drinking too much coffee, too much caffeine. So that's very important to keep in mind. Another thing we need to be temperate with, meaning we need to stay away from, is nicotine. Tobacco produces an effect on the system fully as harmful as liquor. It stimulates for the time being, but when its immediate influence is gone, those who have used it sink as far below par as they have been elevated above it. Similar to the caffeine. These things stimulate you, makes you feel good. That's why some people say, I can't do without my coffee. It does give you, a high. It stimulates you. But then when you drop lower than you were before. And tobacco is one of those things. Let's look at some of the research. Smoking and depression actually has a reciprocal relationship. We don't know which one starts first. We don't know if smoking causes depression or depression can lead to smoking, but the research just found that both of them are kind of related to one another. The more you smoke, the more likely you are to be depressed, and there's a lot of research out there that's showing that, and the more depressed you are, the more you'll smoke. So smoking is something that really we need to stay away from when we think about trying to get over depression. And then there's alcohol. Up to 40% of people who drink heavily will have symptoms that resemble a depressive illness. So drinking and depression is very much related. The concentration of serotonin in the blood of subjects, remember serotonin is that neurotransmitter that we're always trying to fix with the drugs, after they drank alcohol was similar to patients diagnosed with depression. So when they did the blood test for people who had alcohol problems, their serotonin was about as low as those with depression. So we know that something similar is going on there. I know when people used to come into me and they were drinkers or dealing with depression, I would say to them, we can work on all your depression, but when you go home and you ingest that alcohol is a depressant, so it wipes away everything that we're doing. So I had to work with them on getting off of the alcohol because it was just as bad or making their depression worse. So these are some things that we want to be tempered with, meaning we want to stay away from alcohol, we want to stay away from smoking, we want to stay away from caffeine if you're dealing with depression. My advice to you, to be honest, is to stay away from those in general because they also cause other problems with health. And something else we want to be careful with when they're depressed is the big hypnotic box in our home, and that is TV. And the reason I say it's hypnotic is because when we're watching TV, also often our brain waves change similarly to those who are hypnotized. And oftentimes when I'm dealing with my depressed patients, I find that a lot of them are watching TV because it's an escape for them, but they don't recognize that it's making the depression worse because it's not exercising the brain. So depression can often be made worse with TV, and there's a couple of them I actually put on a TV fast, and they found that their depression was decreased. So we need to be careful what we're putting into our minds. What we read can also have an impact. That mind is ruined, which is allowed to be absorbed in story reading. The imagination becomes diseased. Sentimentalism takes possession of the mind, and there is a vague unrest, a strange appetite for unwholesome mental food, which is constantly doing what? Unbalancing the mind. And depression is part of that. The mind is unbalanced. So what you take in, what you see through TV, what you're reading, all of these things have to be monitored. I always give this case example. I had a woman come in dealing with depression. And when I asked her, what do you watch? She told me she watched Jerry Springer and all these kind of related shows. What do you read? Oh, novels. I said, we're going to go on a TV novel fast. It was hard for her at first, but she worked with me, and we found her depression going down. She was also able to make better decisions. She was in a relationship